cultural perspective, we've had this fad of up and down, large breasts, small breasts.
Plastics is just like looked at the field where you can go academic, you can go private, you can have your oldest patients, youngest patients.
I was just listening to Joe Rogan and Elon Musk, and they were talking about every surgeon should be playing video games because it makes them 20% more efficient. So what drove you? Because that was a rough time, man. I visited you and you're sleeping on this. I don't know what that was. It was like a beach chair that you were sleeping night after night.
Dude. With baboons.
I knew this was the best route for me to get there.
I always want to be the best no matter what I do.
I'm glad to be there for you as an inspiration.
Yeah.
So you can always strive to be as good as me. Welcome to the Doctor's Life podcast with the Torabi Brothers here. Today we're going to talk stuff about leisurely fashion with my brothers who love to wear, looks like modern age Lululemon versions of Snuggies.
They are Lululemons.
Are yours Lulu?
Yeah.
Oh, those are...
Yours are too?
Yeah.
Oh, I didn't know.
I usually just see I walk by the mannequin. I'm like, oh, I want that thing.
I want that too. I thought there was like 3 times the price of mine.
Some $2,000, $3,000.
No.
That's hilarious. We got matching Lulus.
Yeah.
So hell yeah, this makes it official. My first time with the most expensive outfit.
Yeah.
Oh no, his shoes. Oh, what a prick.
I don't know. These are Viva Barefoot. What do you mean?
Don't know.
His shoes are more expensive than all our outfits together.
Did you give him those
This
shoes?
is actually hilarious.
I have those same ones.
Oh, okay.
My whole outfit has not been bought by me.
Obviously, you haven't bought clothes for yourself like your whole life.
Even my socks.
You almost look like Saran dressed up for bed.
That's his 2-year-old.
Hey, I'd love to dress like him.
All right, let's hit hard on some stuff. So
Go.
I'll hit both of you and see, go through some questions with you. So for you, you were at Mass General in Harvard doing some research, correct?
Mm-hmm.
So what drove you? Because that was a rough time, man. I visited you and you're just sleeping on this. I don't know what that was. It was like a beach chair that you were sleeping night after night.
Dude.
With baboons.
Yeah. With baboons. What drove you? And you had to actually, you were losing money. So
I was actively losing money. For the first 8 months, I was volunteering.
Yeah.
And then for the next couple of years, I had a salary of $30,000.
Yeah.
And I was living in Providence, commuting to Boston and working about 80 to, I know it sounds fake, but 120 hours a week. I kind of think my experience during my my clinical rotations in the hospital I just knew I had to work harder because I knew I wanted to do surgery and I knew I wanted to be at a place better than where my rotations were.
How much were your train tickets?
I don't
2
remember.
hours each way.
Yeah.
It was hour and a half each way.
So,
and then the last year we were living in outside of Boston, 30 minutes outside. But I was moved back in with the parents after med school and commuting up there. Sarah was still in Michigan because she was still working up there. So
I forgot about that.
Yeah, we were long distance for that at least a year.
Yeah.
So it was brutal, but it was I knew it was what I wanted to do.
Yeah.
Because I volunteered there for 2 months during med school and I knew what it would take I wanted to do plastic surgery.
Yeah.
And I knew this was the best route for me to get there. And I was gonna do whatever it took. And that's what.
But what was your vision every day you're waking up and going to, getting on a train in cold weather most of the time?
As nerdy as it sounds, I love Boston. I like walking between the stations, but besides that, again, I knew this was my best route towards plastic surgery. And I was doing research in hand and face transplant. Yeah. So that could be related. That is a plastic surgery field.
Yeah.
So that was my way of trying to get publications, building up my network in the plastic surgery field. And that's what drove me. And the nerdy part is I really like the science. Like I've been away from it for a few years, so it's hard for me to look at like hardcore raw data and like try to come up with stories. But I really enjoyed the investigative aspect of doing that. So it kind of like just it became the daily thing. And then, you know, like you're saying, like I had a cot in the lab for a few weeks at a time, and it was just like I'd go home to shower and come back, and people were just like, "Oh, you're gonna go to surgery?" When my lab years were finishing, and it's like that's a lot of hours. I was like, it can't be more hours than this. There's just no more hours in the week. Like I can figure that out.
And you got a pretty good hands-on surgical experience too. Or
I
mean, before you even did anything. You know?
Yeah, I was doing some microsurgery and stuff, which I get to do now. So that was, you're right about that. The surgical experience was top notch.
And what was the thought process about plastics? What drove you to plastics, and what part of plastics? Because like to wake up in the morning and go through that brutal day in, day out for like 3 years almost, right? You know, you got to have a vision of what it's going to be. I wasn't in practice yet. So what was that drive that, like, what did you see in plastic surgery that like intrigued you and made you want to be there?
Yeah, I was mostly on that academic track until like third year in residency, when you were like more than well established. I was like, this is the route I'm going. But I really like the academic side of things. And more importantly than that, plastics beyond everything. I love the meticulous nature, and not to crap on other fields, but nobody handles tissue the way we do, with like that little care, little touch. You know, I've always been like a hands-on type with like video games and everything. And then on top of that, it was just like thinking, I've always liked variety. I've liked change. It's kind of like not kind of delaying making that hardcore decision of like, this is where my career is going to go. Plastics is just like looked at the field where you can go academic, you can go private, and you can go everywhere in between. You can have your oldest patients, youngest patients, like kids with cleft lips, elderly people with wounds or scalp lesions, melanomas, and everything in between. So very young, very old, very healthy people, your cosmetic patients, very sick people with chronic wounds. And then it's head to toe. Like we operate, you do reconstruction on everything from the foot to the scalp. So I really like that variety and just the optionality of it.
Was there a patient or a procedure that you saw in med school that was like, you know, that totally blew your mind, and you were like, this is got to be it? Or was it just...
It honestly wasn't. I was lucky to rotate with a private facial plastics guy up in Michigan. And he gave me some really good advice and started my research career up at Wayne State, where I got to work with the ENT guys up there, which was really cool experience. But that was mostly like bench work and data, crushing data. But any of my slower rotations, like I would just text him, and it got to a point where he was just like my radiology rotation, I would finish at noon most days. So he'd be like, meet me at this parking lot. I'll pick you up. It looks shady as hell. I just go to the parking lot. He pulls up with his Jaguar, picks me up, and then we go to the surgery center and just crush through cases. He was just like, he built like this confidence. So like,
also,
why don't you close these? Why don't you close these wounds for me? Or like close this incision while I do this. And it took a while, obviously, to build that like credibility with them, but we just run through town. So like those 2 years, I spent like a lot of time with this guy. He doesn't return my text messages. So I don't know. I don't know how to say thank you.
It also allows your artistic and creative ability. So I think you were the most artistic out of us growing up. So I feel like maybe that drew you towards it as well. I mean, that definitely is a draw
kind of, but it was also like a negative thing, because I'm just like, oh yeah, I got all this leeway, but there's so many different like descriptions and algorithms of like how to think through a process, do a procedure. You do like have a certain sense, especially with with body stuff,
Yeah.
even facial stuff. But then like with the surgical experience, you get to tell you like, I'm pretty sure this is going to heal and look like this. So you change your ways and markings a little bit. But I was a little disappointed. I mean, like, this is so algorithmic in like, okay, this is my measurement for here, sternal notch to nipple.
Yeah.
This is the way I have to draw it. That always kind of like irked me a little bit, but I don't know. It's overall, it's a really good place when it comes to that.
There's cases that, you know, like you go in there, you pre-plan and you got to change what you're doing.
Yeah,
but
while you're in
a lot of it, you're like, you know, a lot of the breast reductions and stuff, you can pretty much pre-plan and make it, you know, go through the whole case. And, you know, people are like, how the hell did you put it together? And it's like, you already saw that. You're like 3 moves or 5 moves ahead.
Yeah.
Yeah. And in training, we do a lot of reductions and like, it becomes kind of mundane, but then like I now think back to like the first few reductions. It's like you're prepping for your case, reading it in a book, and you're just like, wait, what? You elevate here, cut here, raise a flap here, and then you tuck this inside, fold this over, suture it shut. And it took like 2, 3, and then you're like, oh, this makes sense now.
Yeah.
But at first you're just like,
but still, it's still a learning process because it's like different shapes of breast and different skin tension and everything. So you got to, you know, you test things out and you see how things work.
Yeah. The thing I'm describing is like conceptualizing.
Yeah.
How like, because it's not like just cutting something out, closing it.
Yeah.
Your normal practice and like training, we did a ton of that in New Orleans. It was just like a little like caught me off guard of how like complex it is. Yeah. But how straightforward it is once you get it down. And then you just tinker with things to just optimize it.
Yeah, same thing with tummy tucks. We always talk about it. Your markings at the beginning of the case, like kind of take you through most of the case. You make minor adjustments, but it mainly predicts how your scar and everything's going to look, where it's going to land.
Positioning of the scar.
Similar eyelid wise. I mean, it's like our markings are everything.
So interesting thing, you were talking about video games, and I was just listening to Joe Rogan and Elon Musk, and they were talking about video games, how every surgeon should be playing video games because it makes them 20% more efficient.
Really?
Like he had all this data.
Oh, really?
That, like it makes him.
I didn't listen
like
to all his data. I got the gist.
Yeah, just like very quick. Yeah.
It's interesting.
So I was always big into video games. You were. It's like toughest opponent ever. Most of the time he beat me, but I think my endurance of playing for more years.
I think he just played more.
Yeah, because I would I'd go do other hours.
Stuff. And I think you would get mad that you lost to me, and then you'd play for a couple days straight.
But Radbeh was no slouch either. He would just come and like he's a bit of a freak when he like sets his mind to something. Yeah. So it's hard to like. So we had a lot of competition just internally. Yeah, and now it's like it's online. So. I think Elon was talking about being like top 5 in Diablo 4 or something.
Oh, really?
Yeah.
That's so funny.
And he's talking about
it's like meditation for him.
Yeah, he's like if he's a good surgeon,
mind clear.
If he's a surgeon and he's top ranked in video games, it's like that's my guy. I'm like, hey, that's me, bro. I just got ranked in the top 500 in FIFA, the new football club. So I know I was just
not the Forbes 500, but
no,
FIFA 500.
I don't.
It's impressive.
Forbes 500 that can wait.
Impressive.
But this is so yeah. I was just cranking through, and Ari and Sarah were away for the weekend, so I put like a little extra time and went from like ranked 700 to the top 300.
Who's your team that you play as?
Mostly it's either Atletico Madrid or sometimes their defenders get burnt pretty easily. So I level up to Liverpool because everybody picks like Real or Barcelona. So I'm like traditionally Atletico Madrid, but I play mostly with Liverpool nowadays.
It definitely helps with your hand-eye coordination for sure.
So
playing video games.
They talk about it's like response rate.
Yeah, and that's right.
Oh yeah, just natural reaction basically to things.
Even general surgery, a couple of things I really loved about general surgery and I still miss, but like we kind of get it with microsurgery is laparoscopic and robotic stuff. because you're looking at a screen, you're not looking at directly where you're operating.
Yeah.
And I always loved the fundamentals of laparoscopic surgery. Like my co-residents and stuff could say, like, we'd put on a timer and just go nuts, see who could do it faster. That's obviously not how you, not on
operate. The body.
Yeah,
just to be
it's
clear.
a simulation. Yeah.
Simulation.
So yeah, and then to go back to that ENT research where I started the research route at Wayne State, we had to do some microarray analysis, and the software so you get a chip, and that chip had like over 5,200 spots on it. And under a microscope, you set these circles on each dot spot. And if that dot put too much dye or too little dye, you had to put an X on it. So that one's not counted. So you had to have the right amount of dye if it's for it to have any type of like relevance for the results. And I remember like the first day I went there, and I was just like so pissed at myself because I made it through like 30 slides or like 32 slides, something like that. And I was just like, I just spent 8 hours in a dark room and I just finished 30 slides. I'm like, I'm a freaking slouch. And this is me as a volunteer. And I went back the next day, got like about like 40 slides. The third day I go back and the lab director's like, hey, we got to stop you from analyzing these slides. I was like, oh crap. Like, you got to be kidding me. I knew I wasn't going fast enough. And he was just like, we haven't had anybody as productive as you. Like, we pay people full time and they get 8 slides done in a day. And he's like, and your first day you came in and cranked out 30. And then your second day you cranked out more. He's like, we're going to have to stop you. And he's like, and we have to just analyze. He's like, not to say you're doing a bad job. We have to actually have the other people do it and compare your data. So that took like a week for them to analyze the stuff I did. And they came back after that week and the guy was just like, your data is arguably more accurate than everybody's. He's like, he's just like shocked. And he was like, how do you do it? I was like, oh, I think it's because I played a lot of Minesweeper, and with Rodmere, we were competitive with like who would get faster Minesweeper, because the microarrays, the left click put the circle on or drag the circle, the right click X'd it. In Minesweeper, the right click just opens the box, the left click flags. So it was just like, I was just going just like Minesweeper. I would just shut the lights off, blast Wu-Tang, and just me in front of like this 3-colored screen until like lunchtime. And like I'd walk out of the room like, oh, what's going on? It's like, go take a break, look at the sun for like 45 minutes and come back. But like that was a funny experience. And then he was just like, what? Minesweeper? I was like, yeah, let me show you. And it just opened it up and they like just blasted through like one of the medium level ones. He was just like, I have to train everybody on Minesweeper now. So that's a funny video game / medical research story.
My friend was first in the world.
Oh, Breeze?
For Golden Ion Switch. But he legit, to be first in the world, we didn't see him for like 3 months. We were trying to hang out with him on Thanksgiving, and he was like, I can't come out. If I come out, I'm not going to be first anymore tomorrow morning. So
that's what's more impressive about like somebody like Elon that like runs multiple companies and is able to maintain that status. Because like I got to play a lot. I remember the last time I got big in FIFA was right when Ari was born.
Yeah,
it was like 2012. Should know that off the top of my head.
Hopefully Sarah's not going to watch.
I hope that was the right year. Don't worry, she doesn't watch any of my content. but got ranked in the top 5,000 in the world, and I was like so happy about that. But that required like 8 hours a day, 8 to 10 hours a day of playing. But I definitely don't have that much time now. So it's impressive when someone's
sleeping. Then
yeah, it's impressive when you're able to be like productive and
able to do it.
Yep.
Optho has like, they're coming out with 3D scopes that you basically wear like a virtual headset and you operate with it. And people watch it on the screen. So you're basically in like a virtual reality headset.
Well, we had,
operating.
well, we were going to be the first ones to do it with the microscope, that.
Oh yeah, they haven't come out
Were
with it
you guys
yet,
going to try
right?
doing it?
come
We
out with
we stopped using it because it's only at the one hospital and it's tough to go between the actual microscope and the, what was it called?
The
No,
headset.
Olympus.
Yeah.
No, it's a 3D camera.
They came like 2
Wow,
years ago.
Begins with an
I tried it like 2 years ago. It felt weird.
Yeah.
Orbi.
When I was
Orbi.
trying it. I felt like the depth was a little bit.
No,
off.
dude, it was fine. It's just like you got to find the right setting. If you
Yeah,
have
when
the
the
right
settings
setting,
off,
That might
it's
be what
hard.
it is.
Yeah.
Okay.
This one you
Okay.
wear the 3D glasses, but they said they were working on a headset. So
yeah,
That's crazy.
we'll hopefully try the headsets when that comes out.
Yeah.
But the 3D, like I loved using it.
yeah,
Because
Yeah.
you don't have
yeah.
to
Your
like,
neck posture
Yeah,
and
of
everything,
course,
and
yeah.
You're not
and
just sitting there like this.
and also like when you have two surgeons using it, it's small and you can maneuver it around and the areas you can
a lot
see
better than a
like
microscope.
Yeah,
Yeah.
it's better. I mean,
Oh,
a
you
lot
can
of the-
angle it because like you can angle it like this,
yeah,
like where you're never going to get a microscope that have like this angle.
yeah,
Yeah.
So like, or like when you're like digging under a rib for like the internal mammary vessels,
Mhm.
like you just like,
definitely
this
helps
here.
with fatigue too. It's
Yeah.
like
Yeah.
yeah, there's almost like
Yeah,
no
I mean,
fatigue.
I know all surgeons get C-spine issues, obviously, but ophtho is like notorious for it
Yeah,
because of that posture and the scope
yeah,
and the slit lamp. So
a lot of breast surgeons. You do a lot of breasts. There's a bunch in town that have required surgery.
yeah. Surgeon's life isn't.
It's
That's-
hard work.
Yeah.
It's,
Yeah.
it's way harder than I thought. Even
Yeah.
liposuction,
Yeah,
dude. Like
lipo's tough.
last
Well, as
Christmas
they
break
as
when we got to
yeah.
it, it was just like it's getting like
as you're increasing volume too, like you're expected to increase volume, it just gets harder and harder. You know, like you're just working more and
yeah.
like, and you tire out more, so your posture is just getting worse and worse. And I have all these contraptions and everything to.
You're
improve
doing a
my
lot
posture.
better. You were
Yeah.
in rough shape when we moved here.
Yeah, I just like
You've
just been
gotten a lot
taking care
healthier
of my-
too.
yeah.
Yeah, you've done all the
Yeah.
right things.
just paying attention to it. So now, Ram, your turn at your journey. So the different thing with your journey is you did a bunch of research, like after you got out of college. So your research was in ophthalmology, or what was
yeah,
it?
so my research was at UPenn. It was in ophthalmology. We were doing research to find the genetic basis of glaucoma in African Americans. That was our main study that we were doing. I think what drove me into ophthalmology was I just had great mentors there initially. There's an eye disease called Leber's.
Don't make this too interesting.
Yeah.
Yeah, I'm not going to go too crazy. But basically, I mean, the kids are born, they're ultimately born blind. But there was specific people at UPenn that found a gene that they can inject into the eye that it took them like 30, 40 years of doing research. So the
Oh, wow.
whole nerdy academic thing, they
Yeah.
found basically gene that these patients don't have, injected it into the eye, basically show up like a kid, completely blind, and then at 10, 11, seeing. And
Yeah.
I think that was my like, holy
That's
cow,
awesome.
this is really cool.
Yeah.
And that was like my driving thing. I just saw like I initially saw that and I'm like, oh, this is really cool. And then what they did just it seemed like they were just making such a big impact and
Yeah.
a quick big impact. Like day one cataract surgery, say someone comes in 2400 and then 2020 the day after surgery. It was just really cool to see that kind of impact on people's
Yeah.
lives. So that drove me into ophthalmology. And then medical school, I think I just
Wait, any famous people with that? Was it Leber's disease? Like somebody
Leber's.
like Ray Charles?
no
Or
Ray
Stevie
Charles,
Stevie Wonder.
Stevie Wonder, and one of them had retinopathy of prematurity, so they were born at a young age.
Okay.
So their
That's Ray
retina didn't
Charles,
produce. Yeah, or it was both. I need to check. I forget.
It's all right.
Were you
Sec.
doing the research before, or like
This was
you got
before
into
med
the?
school.
No, I
Yeah,
know
that
that,
was before
but
medical
like
school.
you were doing Masters of Neuroscience at UPenn. How did you get into that?
Yeah, I did a post-baccalaureate program at UPenn, basically to try to get myself into medical school.
Okay.
And then I did research the second year while I was applying to medical school.
Yeah. Did the master's program help you get into that optho, or you found it yourself?
No, I just found that myself.
Okay.
But I was there and I saw the opportunity.
Yeah.
And I needed something that was research.
Yeah.
And so I sort of fell into it. And then I was like, oh, I didn't even know this field existed.
Yeah.
Which a lot of people don't know.
But did you have some connects from your research years that eventually helped you out to match?
Yeah, big time.
Is that what you're asking?
No.
Okay.
Just how you got into the optho research.
Into that optho research.
Oh, okay.
Yeah.
I found out about it because they were looking for people.
Yeah.
And that's part of the post-bac program.
It wasn't part of the post-bac program. No, it was just a year of research that I got paid as like a postdoc fellow.
Oh, yeah. That's right. Right.
I basically got paid as a fellow and was a clinical research coordinator.
When you were at BU, did you do anything that was along ophthalmology, or was that a separate?
I actually did. I did a thesis at his lab.
Okay.
So I was at Mass General as well, and I ended up doing a thesis there. Well, we won't go into details on exactly, but it was.
This is really exciting stuff.
Yeah. We're not going to go into details.
And then how about?
But I did the same thing. So I would travel there from Providence for like a whole year.
Yeah.
And not get paid.
Dude, our friend Chris did it too. He's an anesthesiologist now, right?
Yeah.
Like that lab cranked out a bunch of successful people, man.
Yeah. It does.
Dr. David Sachs, his lab, just looking back, it's just like everybody, like all the research techs, like just accomplished exactly what they set out to do. Like, this is my goals and this is what I got to go do. Mm-hmm. So I think that's the importance of having the appropriate mentorship too.
Med school, I was like still trying to figure out what I wanted to do, but I definitely liked the ophthalmology cases. But I remember like one of my favorite cases was actually a Mohs recon with a skin graft. I was like, oh, this is really cool. We did like a posterior auricular, but I still thought I was just going to do ophthalmology initially until I got to residency. And then.
So in residency, you were thinking of retina or oculoplastics,
no,
or was it just like you thought retina?
I was thinking more. I honestly, before I started, I was thinking of peds ophthalmology, but then I spent one day with kids screaming and yelling and not being able to get an exam, and then it worked out fine, but I just was like, I can't do this.
Yeah. My realm of peds, I love peds, and for me, it wasn't an issue. It was my issue was like, I've already been doing this for 9 years in training. So let me go and operate, which I think I decided at the right time. That was the main thing, because I wanted to do peds. My wife wanted to do peds anesthesia, but like, it's also
general
like
peds or peds surgery.
No, peds plastics.
Oh, okay.
Yeah. Never just peds.
What made you pick plastics? Because I remember you saying like, because my mom was like, you should go to plastic surgery. I'm like, I'm not doing that many years. Yeah. So there was definitely a switch, and it didn't take long.
Well, I never wanted to listen to mom anyway.
Of course,
so that's you got to kind of have drive for where you're going and what you want to do. And when people told me no, I was like, oh, I'm going to do that. So it was more, that was more of it than
other than just
people telling me no, you should go and do it.
You had to assess like what portions, like what things. Is this some of the stuff?
But like the other thing was like, just from med school, like I found surgery was like my thing. Like I wanted to wake up. I did not want to do medicine. I didn't want to do gyne. I knew I didn't want to do a lot of other stuff.
Yeah, it was definitely going to be procedural for me too. Yeah. Like right away, like even before like my first day, I was like leaning that way. And then it was just like the first rotation was surgery, and it was brutal because everybody's like, oh, you're going to hate it. Except you and Ramyar were like, this is what you're going to love doing. Yeah. It's just like, this is great.
But like when I was doing plastics, like, the cleft lip and palate guy, like that just blew my mind. I was like, you know, and then I had watched Project Smile and stuff. And I was kind of touched by the clinics he ran with like the kids. He followed them their entire life and go through all these procedures and stuff to kind of change their lives was huge. And I was like, all right, this is kind of what I really want to do.
The pediatric stuff's crazy too. It's even more complex than the breast reductions. So it's amazing what you can do. And how, like, just thinking about how people conceptualize putting a cleft lip together, like, you kind of like when you get it, you're just like, oh, it formed this way because of that. So how can I recreate what the normal anatomy would be? You've done a lot of different things in heavy volume and plastic surgery. Yeah. What do you like most?
I'm beginning to like the cosmetic realm more and more. I've gotten into this, you know, and how I get focused, like doing the peptides and wellness thing. And like, I think what intrigues me now is like how I can provide like top level service, like service beyond service, that patients are going to be just wowed by the service. Yeah. Even more than their results is like, you know, they come in and like putting together a team and an office that like everyone's happy being there and like the patients are happy being there.
They're just straight up cranking. They're awesome right now.
They're cranking at such a high level. Like the patients are saying it too. It's like, they're like, it's just like such an unbelievable process. And I want to be like the Ritz-Carlton or the Four Seasons where, you know, the patients come and they're like, the red carpet's thrown down for them and they're just taken care of. I hear it a lot from the reconstructive patients as well as the cosmetic patients.
Same, so it's nice.
I always want to be the best no matter what I do. So it's like, you know, a driving force in the next step and the next step.
I'm glad to be there for you as an inspiration. Yeah. So you can always strive to be as good as me. No, it's amazing. Clinic time right now is like the best time I've ever had. Training, practice, just going to clinic, hanging out, seeing patients. Patients are so happy. You're not going to know anything else since.
But it's been, I mean, everyone's been amazing.
But it's a lot about like just caring, you know, because like, and first of all, like, you know, we've been working with Andy Elliott and stuff, and he says how like you need to take care of yourself. And once you start taking care of yourself and cleaning all that up, like your mind, your body, like then you can take care of everyone around you. And then it just spreads, you know, and like once you've taken care of yourself and like built that confidence, you can start building confidence in other people and and they'll follow along with you and go through paths and they'll go through fires and wars with you, take your back. And that's what you need. And that's like what we kind of got right now. And like just trying to keep on forcing it. And like even my relationship with my wife, like it's like 100 times better. Just being healthier, me being healthier, her being healthier, like just all out, like the experience is much better. And we just, you know, treat each other better and it just feels.
If you're not just naturally tired, you're going to be a better human being. I know like I'm very chill. I never flip out. The angriest I get is when I'm freaking tired. Didn't sleep well. I'm not eating appropriately. I like ate like trash. So like after lunch, I'm more tired.
I try to make up because I know like I take our 9-month-old, I'm like, I'll stay up with him. I'll take him for a night. And I don't know how my wife like does that. Plus like takes anesthesia call. And I'm like, dude, you barely sleep. I'm like, even after one day of not getting appropriate sleep for me now, it's like, I'm going to take my nap and I'm going to make sure I get to bed early the next day. But she's like working. And the next day it's like, you know, this came up and you don't have time to rest and you don't have time to go to bed early. So my mind's just crazy, especially in the morning. I have like 6 new items that I want to implement, or whether it's with the office or like real estate projects or, you know, or
you
new
seem
projects.
Like you're all over the place, but you're really focused on it's actually a finite amount of things.
I'm like now, like I don't procrastinate, and I'm like I'm more like focused and like I'm going to get this done, and like I go at it.
Yeah.
And it's like full force, like spend hours and time in between, like to get stuff done, to just, you know, for different things. It's
fun to watch and take part of.
Yeah.
It's pretty awesome.
That's a whole thing I was working at. Once I got healthy enough, I was like, all right, I need to fix my gut. I need to fix my body. And then it was like, now it's time for the brain, and like how do I get my brain to function at its best? And with meditation, with, you know, whether it's NAD or like different supplements to get it to that like superpower and get it to firing, you know, like what do you use 10% of your brain to get it to use?
Average person.
To get it to like 50 to 60% as much as you can. I think after 2 o'clock, it's very hard to keep above 30%, but like try to get it.
30% firing. It's like genius level.
But like when you're
that was
operating,
my excuse,
you feel it
like
too.
when I was in undergrad, people were like, why are you doing all that? You're killing all the brain cells. I'm like, well, use 10% of your brain. So there's a 90% chance the brain cells I'm killing aren't even worthwhile.
And a lot of people don't believe, like, you know, which I used to, like, when people told me my patients told me they didn't drink, I'm like, are you serious? And they're like, I don't drink, but I smoke cigarettes. I'm like, how do you smoke cigarettes and you don't drink alcohol? I'm like, it just, you know, but now like I feel so much better. And like, not that like I'd go and smoke. I think both of them will affect how your brain functions.
Definitely.
Although I do take nicotine in small doses, as we've discussed before, when I need to get that extra like 2 or 3 hours of work when I get home at night, I'll like do a nicotine troche and I'll fire away.
That's what does it for you?
I can just focus and function at nighttime where my mind would be all over the place.
Is that why the Zyn pouches are all on fire in like the tech world and stuff?
Probably. I don't know. Like I never heard of them until you guys told me. I get a troche from the compound pharmacy. I wouldn't want to do caffeine that late at night, but
no, I know. It's just
even nicotine's probably not good.
Caffeine and nicotine.
Yeah.
Mix. I don't even know.
That's what you were saying. It's caffeine and nicotine. I think we looked into it.
Oh, I didn't know there was caffeine.
I think so. I don't know. I shouldn't.
I thought it was just nicotine, but it feels terrible.
It feels terrible, does it?
No, it feels good, but then you come down and you feel terrible.
Do you come down?
You get headaches.
Yeah.
If you stop taking
you take caffeine though. It's caffeine.
No. It's you get headaches after the Zyn pouches.
But it has caffeine.
He's sensitive to everything.
Yeah.
He's sensitive to everything though.
I am, but Radmir got headaches with that.
It's 1 milligram. Yeah.
That's good.
It's not.
Nicotine, the troches work in the similar pathway as the NAD. Is it?
I don't know. Probably it's nicotinamide. Like, you know, it's going to produce ATP. So cultural perspective, I kind of like with cultural perspective, different areas have different, you know, even you go different countries have different things that they look at. Some countries, big is beautiful. Some places it's not. And we've had this fad of up and down, you know, large breasts, small breasts, large breasts, small breasts, large breasts, or BBLs, which big butt. Now more people are going towards more athletic butt as Ozempic takes on.
Natural noses.
Yeah, natural noses. What are your thoughts about that? Like, as I read more into preservation, rhinoplasty and stuff, you know, some people get good results, but like just thinking, like some people, their dorsal hump comes back because that bone pops back out.
What's preservation rhinoplasty?
So what you do is you pretty much keep the dome attached and you're doing all the work underneath. So you basically move everything down.
On the inside.
Yeah.
Okay.
So you preserve the structure of the nasal dorsum.
Yeah.
And on the inside, you reduce the septum and you create like a small bone fractures on the outside and kind of like bring this in and suture it on the inside. Because they say like it's hard to get that natural like point of the nose because it's not just classically like in our literature, it says the dorsal lines, which is 2 straight lines, but it actually most people's nose like point in. And some people compare it to like if you're looking at an F1 car from like the top down. So it comes in like that. Not quite as bad as Owen Wilson's nose, but something like that. And a lot of people like to, I guess now, like to preserve that. But I haven't done many preservation noses, so I can't talk one way or another. I stick with the open approach, and I really love the results I'm getting, and it's getting better and better. So I don't have really a reason.
Yeah.
Like if I was just like, you know, this is definitely gonna
Make a huge
my
difference.
results better. I can already make my results better with each case.
Yeah.
Just tweaking little things. So it's a cool concept, and there are definitely some patients you just like, oh, what you want is this is the exact procedure.
Some of it also with the whole ultrasound thing used to fracture the bones.
Yeah.
The piezo device makes it more doable. It does take quite a bit of technique, and you have to do it repeatedly to kind of get it down, because to just like, you got to cut the bone and the cartilage in the right places to be able to shift the bone and cartilage down so it sits smoothly. Yeah. So
it's a funky procedure. It's actually like the concept's cool.
It's not new. It was done before,
Yeah,
but people went
for a while. But
Rorik does it. He was talking about it, and he's like, he does it, but not as often as he does regular rhinoplasties. And he's like,
Rorik's a fact.
Yeah. But he says like recurrence of the dorsal hump is possible with it. So
I understand it's possible, but it's like technically, like if you do it properly, it shouldn't be.
Why not?
I don't know. Just with like gravity and forces, like it would have to shift up as it heals in.
So, which it can if you build like a bone spur and stuff. The thing is, you sneeze and stuff, that stuff could get pushed back out.
True.
Unless you're stabilizing it in some way.
And when I do it with like the removing the strip across the bottom is just place a couple of PDS sutures at the base.
Ram, question for you. What are the different kinds of brow lifts?
Most easiest is usually a direct brow lift if you have like temporal hooding here.
Yeah.
Then endoscopic brow camera. And then we have pretracheals, another common one.
Yeah.
Right in the hairline.
Yeah, I've done one coronal in practice, and it was massive weight loss patient. Yeah. But the scarring's not the best.
Not the best. Yeah,
I do more
scarring's best.
Who's a candidate for it? Like who would need to get it?
Yeah.
And who would you do the direct
males usually?
The direct's only very few.
Old males that you can hide the scar line within the hairs here.
Okay.
Someone like me eyebrow with the bushy eyebrows.
Yeah, same with me. Yeah, which is more. You'll be surprised. I mean, most older males have pretty bushy eyebrows that you can hide the scarring, and they just need a little temporal brow lift. I think endoscopic. I think a lot of females with the forehead, you always have to look at their forehead length, because a lot of people. I think that's the difference with the endoscopic versus the pretracheal, because the pretracheal won't make their forehead bigger, and a lot of female patients already are like, oh, my forehead already looks longer than it is, so the pretracheal is a good way to
how does the endoscopic make the forehead longer?
I think it elongates it just a little bit more, because
with the coronal, like if their forehead's already large, you go in front of the hairline to pull back. If you're going behind the hairline, that's gonna
like 5 millimeters behind the hairline.
Yeah.
That scar line, like as long as
it hides
whatever the
well.
surgeon, it hides really well.
What are the indications for brow lift?
Patients will have temporal hooding, or if they just want a recontouring. If a lot of times males will have lower brows no matter what. Females are usually a higher brow.
Yeah.
And more arch brow.
What's usually the location of the brow between the two?
The males are going to have, the brow is going to be low set on the bone.
Yeah.
And females, the brow will be higher set.
Okay.
And that's more beauty aspect.
What are you usually looking for? Do you have a measurement that usually?
For the patients that are insurance-wise that are coming in, I'll always check their eyelids with forehead always relaxed, because a lot of these people, if their brows are drooping, they end up using their frontalis muscle to pull up. So I check them. I basically hold the frontalis for like 30 seconds or so that it doesn't function, measure where their eyelid height is compared to their pupil, and then I raise their lateral brow to see where that eyelid height is
Yeah.
after the brow's up, because that drooping, a lot of times, even with the skin on the eyelid, it's actually from the eyebrows, especially on that lateral aspect of the brow. And, you know, some people, cosmetic wise, they get a little bit of drooping here.
Yeah.
And a brow lift really brings them above that rim and makes them.
Yeah, I really like the pretracheal, like temporal brow lifts. They work really well. Do you do any corrugator resections or anything?
I've never done a corrugator resection, actually.
Right.
Have you seen good results with it?
No, like I was just looking through them, and if someone's really got the 11s, I think it's a good idea.
Helps,
but a lot of the other ones, it looked like their middle eyebrow would just split so much that like it just looks weird.
It doesn't look good.
Yeah, it gives them like the surprised look. And like even when you're having a brow lift, even when you're having a brow lift, you got to have the appropriate tension so it's not like elevated too much.
Yeah.
So
this has been an episode of Doctor's Life Podcast featuring the Sweatpant crew here. Join us in a couple of weeks. We'll discuss some more procedures and lifestyle.